Hello, this is Dr. Nemechek. I want to give you a little presentation about our practical use of vagus nerve stimulation in the kids we see in our medical practice. First, I want to just touch on and let everybody know our second edition of the book is going to be shipping in June. There's a lot of extra tables. We go into detail how to go from inulin to rifaximin. We discuss vagus nerve stimulation, very detailed explanation of anxiety, aggression, how to manage the plateau, a good understanding of what PANS and PANDAS really is. A copy of the book is available for purchase at nemechekprotocol.com. And one of the things you'll find in this book is a lot more charts that'll help kind of graphically describe how to manage a lot of the problems that you're encountering. Now, what's the Nemechek Protocol do? And I say this over and over every day. All the Nemechek Protocol does is lower inflammation. That's our stated goal. That's all I obsess about every day, is how do we lower inflammation in these kids? And when we lower inflammation, it results in allowing the nervous system to recover. All right? We do not fix the brain. We lower inflammation, and the child will fix their own brain. All right? Now, there's just three basic components here. So in the protocol, you start with the fish oil and olive oil. That's dosing by age, and you change that every couple years. Then we have to balance the intestinal bacteria. This is probably the most important thing right at the very beginning. We use either inulin or rifaximin. Now, if inulin or rifaximin are failing, this is when you get the plateau. I'll touch on a little bit later, all right? And then after a while, after on this for a few months, then we assess if we need a vagus nerve stimulator. The vagus nerve stimulator also lowers inflammation, and so this is added if recovery is incomplete. And vagus nerve stimulation involves a simple clip on the tragus or in the bowl of the ear. This helps lower inflammation. It improves recovery, neurological recovery. In many individuals, it'll decrease anxiety rather rapidly. It's only needed in the kids for 5 minutes per day, and it's very painless. It's safe. It's something that's been in use in medicine for about 20 years. Now, here is a description of what happens in many of the kids. So here you have neurological recovery, and this is time. I should put a label on there. But you start the protocol. Now, if you see your child in all these different areas are recovering, awareness, socialization, sleep, speech, emotions, hyperactivity, focus. If you're seeing that everything is recovering, that means that inflammation is fully suppressed and the vagus nerve stimulator is not required. But if you start the protocol and you see a lot of things, so you'll have a lot of things improving over time, but over about 3 or 4 months, now this example is speech, but it can be any aspect, you'll see some aspect not recovering. And that takes a few months for you to notice the difference here. And what that implies is that you have excess inflammation in the region of the brain. You start the vagus nerve stimulator, and within, as you can see, you'll have rapid recovery of whatever residual domain was lagging behind. And typically improvement will be in about you'll start seeing improvement in about 4 to 8 weeks. This is different than the plateau, okay? Now the plateau is you start the protocol, you have a bunch of things getting better, then everything stops. Not just 1 or 2 things, everything stops. That typically is either you have inulin failure or you're having some rapid relapsing of rifaximin, and the book will go into and describes, as well as my other videos, of how do you manage that. So now, we went back and looked at, you see almost 700 cases, 685 cases of kids we've been taking care of. It ended up overall 67% of the kids actually ended up requiring VNS, vagus nerve stimulation. Of those kids, 81% were starting to show improvement within 1 or 2 months. Now, improvement is based upon what the parents and the therapists are telling me. It's basically, oh yeah, wow, we put that on him, and just in a short while, there we started seeing the improvement. And this improvement covers a variety of domains. So speech was the most commonly used, and we would see 83% of the kids would show improvement within the first couple months. Motor function, in terms of hypotonia or just fine motor or gross motor control, 100% were showing improvement within a few months. Focus on attention, you can see, is 96%, and aggression, decreases in aggression, emotional regulation, that improved in 87% of the subjects. Here's our Vitality Smart Cable. We've designed this specifically. It's a one size for the kids, 5 minutes. You run it at 10 volts, and it's available at vitalitysmartcable.com. I want people to know we have a variety of other products to help people be able to get the highest quality products for their kids. Available this in June 2021 is now our organic blue agave inulin called Nemechek Blue. We put this out in the marketplace because there's a huge shortage of inulin worldwide due to the stress of the pandemic. And as most people are aware, we have now our second harvest, the 2020 harvest of Nemechek Gold. And I have to say, this flavor this year is spectacular. And overall, when you just look at the effectiveness of the protocol, when you put everything together, this is a review that was done. We looked at 407 subjects. They had been on the protocol an average of 21 months. 90% were showing increased recovery as per the parents' assessment. 67%, as we mentioned, were requiring stimulation for speech, focus, behavior, and motor function. So I want to thank you for taking time watching this short video. This will be posted on NemechekAutonomicMedicine.com, as well as our YouTube, Facebook, and LinkedIn pages. Take care.